Hi everyone, I'm Dr. Stephen Kelly and welcome back to my channel. Today I'm talking about a very serious topic, the dangers of bariatric surgery, medical tourism. If you're considering travelling abroad for weight loss surgery, this could be one of the most important videos you watch. Medical tourism involves travelling to another country for weight loss surgery, often because of advertised low prices. These countries, like Mexico and Turkey, advertise these procedures for a fraction of the price. You may have seen frequent social media advertising and also glamorous websites with tropical beaches and smiling patients. However, the truth behind these advertisements is wildly different. The medical tourism industry in these countries can be very unregulated, with poor surgical standards and poor patient care. New Zealand bariatric surgeons are dealing with an increasing number of complications related to patients going overseas for surgery. These complications have been very serious, with some involving complications never seen before by New Zealand surgeons. These include swabs left in abdomens and weight loss surgery being performed on people who are not even obese. Other problems we have seen in New Zealand include very poor preoperative preparation without the usual safeguards put in place. The wrong operation may be recommended. Even when patients do consent for an operation, they may receive a totally different operation unknowing to them. We have seen very poorly performed surgery where stomach pouches are not constructed correctly, or the surgeon staples the stomach too tightly and the patient cannot swallow. Of particular concern can be the lack of good post-operative care. Sometimes when serious complications have occurred, patients have had their symptoms dismissed by the operating surgeon and the care that they need is not available until they get home. Blood clots to the legs and lungs are more likely to occur on international flights soon after bariatric surgery. Infections with multi-drug resistant bacteria are more common in these countries. The increasing number of serious complications has recently been highlighted by the British medical authorities. It was identified that 28 British people have died having bariatric surgery in Turkey in the last 5 years. That's one person dying every 2 months. Authorities are demanding urgent action to deal with this problem, including international regulation of the bariatric tourism industry. At home in New Zealand, bariatric surgeons are well trained to provide safe and effective bariatric surgery. All surgeons are credentialed by each hospital. Most New Zealand surgeons participate in a national audit that monitors surgeons' performance and enables ongoing high standards. In New Zealand, you will get the operation that you need. It will be performed safely. Importantly, you will receive excellent post-op care. In the unlikely event that there is a complication, you will have peace of mind that the problem will be resolved by your surgeon. The cost difference of a weight loss operation between New Zealand and overseas is now relatively small once you include flights and extra hidden costs. Given the improved care and safety in New Zealand, this extra cost is well worth it. So book your surgery in New Zealand today.